Good morning. This is Steve Stites, Chief Medical Officer at the University of Kansas Health System. I made it all the way through that without a mistake. That's impressive. I am joined on my right by Dana Hawkinson, Medical Director of Infection Prevention and Control. We're broadcasting live here in the Dolph Simons Family Studio, and we have two very special guests today. One is Jeff Long, who joins us on the line, and I think you should be able to see his picture. Jeff is the Athletic Director at the University of Kansas, and Jeff's going to talk with us a little bit about plans for Jayhawks to get back to sports and what's going on. But there's a bigger conversation as well with my good friend Doug Girard, the Chancellor at the University of Kansas. Doug is a ENT physician here at KU and still practices from time to time and is Chancellor on the Lawrence campus. And we're going to talk a little bit about reopening of that campus and what plans are there. And before we go there, though, Dana, I was worried about our weekend. I was worried that we were going to see the numbers really take off. We've been open now for about 2 weeks, but the weekend was stable here at the hospital.
Yeah, it was actually good. You know, we were concerned on Friday because we had 24 patients in-house, and that was up from a low, I think, of about 14. And that would have been reflective of the various stages of reopening from the 10 or 14 days prior. Over the weekend, you know, we did have some discharges. Currently, we're sitting at 20 patients in-house. Only 6 of those in the ICU, and only 3 of those are on ventilators. So I think that is some cautious optimism there, but of course we need to continue to look forward, and until we know the full data, by looking back, we don't know the full effect of everything, including the reopenings.
So Dana, a lot of pictures this weekend from the Lake of the Ozarks. Man, what did you think?
Yeah, you know, my first gut reaction and word is just irresponsible. I understand, we've said, you know, we want to be out and social with people, with our families, but there are ways to do that. You know, we've said be outside is the best thing and social distance, not be outside or social distance, but both of those things. You know, it was certainly irresponsible. We know that COVID likes to find susceptible hosts. We know that it's very easy to spread from one person to another when there are people close to each other, and so that's really certainly a concerning aspect.
It is a concerning aspect. We won't know, of course, for 1 to 2 weeks the impact of that event or other events like it. I was out in the Ozarks this weekend too, but I was down in the Mark Twain National Forest in southwestern Missouri along the Roaring River. Not as many people where I was. In fact, pretty much nobody down there. It was, even on a Memorial Day weekend, it was pretty quiet. Didn't look like the Lake of the Ozarks. But Doug, as we think about reopening college campuses, those are the kind of scenes that's got to keep you up at night, because as both a physician, a leader, chancellor, all those things, you know all the medical part of this, and thinking about fraternities, sororities, and college campus. How do we go about reopening a major college campus like the University of Kansas?
Yeah, you know, I think we're discovering, like everybody else, that it was a lot easier to close down than it is to open back up again. And so as we, and working with our colleagues around the country, trying to think through how we do this in the most responsible way possible, looking not just at the living environment, which we control a small part of, but not a big part of when you have some 25,000 students
Right.
in town, of which we have about 4,000 on campus. So, but doing the best we can in that environment and thinking about and working with your team to think about how to do that most responsibly. But also the classroom environment and thinking about how we do our best to create the safest environment, not just for our students, but for our professors and our staff who are working face-to-face with everybody. And so, you know, it's going to take a lot of thought. It's not going to be our typical opening, for sure.
Right.
And certainly some things just aren't going to happen because we're just not ready, and events are a very big one of those, and where you just have those really large gatherings. We're working very closely with the city and the county about how, in our business community, to think about how we re-engage them as safely as possible, and they've been wonderful partners through that process. To think about what they can do within the community to help make sure everything, you know, the worst thing you can do is reopen it and have to turn around and shut back down again. So we want to do it right, we want to do it slow, and we want to do it safe.
And the Lawrence community, the business community there on Mass Street, must be really affected by the college not being open. I mean, it's always been slow during the summer, but man, when the fall and the spring aren't there, gosh, that's tough.
It's a tremendous impact to that community, and we realize that, and certainly the lack of events is a very big impact to that community as well. You know, having to postpone commencement. We typically put about 26,000 people in that stadium for graduation, and having to postpone an event like that, which was really hard on everybody, but we will do it eventually. Either this fall, maybe next spring if we can't do it this fall. But,
I talked to some folks who missed the walk down the hill. They were pretty upset. I mean, some of the graduates, you were a graduate, right?
Yeah.
And you walked down the hill, and you were talking about that in this program one time. But, man, that was a big deal, and all these kids not getting to do it.
Right.
and, yeah, I actually got to do it last spring with my son. So I graduated last year. So
Big tradition.
this master's program, great tradition. Anyway, it was many events, many losses not to have those events for our entire communities. But
it is tough.
we're looking and working hard to think about how best to re-engage, how you stage moving in, how you control the environment once they're moved in. But as you saw in the video, there is a big component of personal responsibility that comes with this.
Yeah, there really is, and we've been preaching that here on the program about trying to wear a mask and maintain your distance and cough in your elbow. And in that video, I don't think I saw any of that going on. I think I saw a lot about business as usual, and that can be tough because I think COVID is so real. I think folks are just tired of it being still being real, and they want to go back to normal, but I'm not sure it's time yet.
There's an element too of because I think we did a pretty good job
We did
in
a
the
great
state of
job.
Kansas and Missouri
job.
to getting in front of it, and so the impact. I mean, there's a lot of people who don't know anybody who's been sick.
Yeah.
Quite honestly, because we've been able to keep those numbers down.
Yep.
I know actually several people have been sick and some who had lost parents, and so it is very real, but I'm not sure everybody's had that experience, and so it's a little bit nebulous out there.
Yeah, I think people think, well, gosh, maybe it's overblown, it's over talked about, and people got too excited, they got panicked, and we're not New York, and unfortunately we're not New York and Italy. But the idea that it's not real will unfortunately run into a stone cold reality when you start to lose people who you're close to. That's hard.
And in our community, in particular in Lawrence, with Lawrence Memorial Hospital, it's only had a handful of admissions over the course of this, and the case number's been very low in the county. Again, did a great job of getting in front of this. Not inviting 20,000 kids back to campus from spring break probably helped.
It probably helped a lot.
But again, we just haven't had a high incidence in the community, and people are getting a little cabin fever.
We are getting cabin fever. Jeff, I know we have cabin fever about sports. I could watch the Chiefs replay of the Super Bowl a number of times, and I still am entertained. My kids could watch like The Office 27 times. I watched the mic'd up version of the Super Bowl about that many times. But getting back to college sports is just something that's such an integral part of the community and really of our nation, our social fabric. Where are we for that with KU athletics?
Well, Dr. Stokes, thanks for having me on. First, I would say, we're a subset. We're a subset of the campus, and certainly we're part of the university, and we follow all those guidelines. So, I look at our situation. We have our governor who has put out the parameters in which we can function down to our county, our university. And then with athletics, we also have the NCAA, the Big 12, and then, as you know, an important part of what we have is Kansas Team Health, which is a makeup of UKHS and LMH hospitals to run our athletic sports medicine program. So we have many layers of this, and just like everyone does with COVID-19, we've learned a lot, and we continue to learn as the weeks go by. But our programs have been shut down, as all programs have across the country, but we've continued to stay in contact with our student athletes through many contacts, through our coaches, through our trainers, through our strength and conditioning coaches, nutritionists, mental health professionals. We have our whole KU lead staff and our academic staff and our tutorial. So we've had constant contact, whether, virtually or through the phone or through text messages with our student athletes. And we're beginning to prepare to come back. And we've recently decided in the Big 12 that June 15th will be the first date that student athletes can get back to voluntary workouts on our campuses in our facilities. And then July 1st for the remainder of our fall sports. And then July 15th will be when our men's women's basketball programs can come back and use our facilities. So that's where we at this point in time. We're still learning a lot and implementing all the strategies that have been outlined for resocialization.
Well, the best of luck, and it is our privilege and pleasure to both work with you and with Chancellor Girod around the reopening, and I think we'll work hard. I know we'll all work hard to make sure we get it right, keep kids safe, keep communities safe. And just as a foreshadowing for tomorrow, David Smith, who is our Youth Sports Medical Director and KSHAA Advisory Committee member, will join Royals athletic trainer Nick Kenny and Dr. Vincent Key, who is the lead physician for the Royals. We're going to talk about youth sports, and I'm sure we're going to get into a little bit of a discussion around professional sports and what's going to happen with baseball. So from a medical standpoint, so I invite y'all to listen tomorrow. So let's first turn to our media and ask if they have any questions that they'd like to ask, especially to Jeff or Dr. Girod.
Good morning. It's Cindy from KCTV. I actually have two questions. Seeing those pictures at the top of this, all those pictures from the Lake of the Ozarks, can you again touch on the importance of contact tracing, especially after a weekend like we've seen?
Yeah, let's talk a little bit about that, and then the request for even self-quarantine, Dana.
Yeah, so I think self-quarantine, I think that's a good request. I think it was St. Louis County, maybe. I don't know if it was all.
And Jackson
MD.
County both.
Okay.
Our city, Kansas City, Missouri, and St. Louis County requested.
I think that's very important. I think people should try to abide by that. If we look at what happened, though, probably personal responsibility for that part might not happen, and that is why I think moving forward, especially wearing masks are going to be important, especially if you're pre-symptomatic and asymptomatic. We did see that there were a couple hairdressers that maybe exposed 90 or 100 people in Springfield. As of yet, I don't think there have been any cases, and I think what was reported is that both the hairdressers and the clients were wearing masks. So I think masks will help cut down if you are not going to be self-isolating and quarantine as under public health guidance. Contact tracing is going to be vitally important here for both sides of Missouri, the St. Louis and the Kansas City side here. We know that some of the county health departments have been overwhelmed and have a lack of resources. In addition to the contact tracing, also what's going to be important is the ability to get the PCR test and test those people that may be pre-symptomatic, asymptomatic, or have symptoms at this point. So it's a combination of all those things.
So to be clear, I think what we would say is if you were at one of these events, the risk of you having to get COVID is pretty high, mm-hmm. and because it can be pre-symptomatic in people, you may not know who is sick, and I would dare say that people weren't exactly washing hands and coughing into the elbow at that event. There were no masks. Right. But if you were there, the way you keep others safe now is to wear a mask. And if you're around everybody, you need to make sure that people around you wear masks. Now, I don't know if the folks who go to those events are also going to be the ones who are going to be socially responsible enough to do that. But from a public health standpoint, that is absolutely the thing that they should be doing, along with washing their hands, not touching their face, and trying to maintain 6 feet of distance. But hopefully folks will wake up and feel like the day after, hey, maybe I didn't make the best choices right then. And then they'll take it a little more seriously. And just remember, if you go home, you're around your loved ones, you're around your parents, you're around your grandparents, they're the ones that are going to be at risk. We know from our data already that that it's the older folks who are the most vulnerable. We may have deaths in a younger population, but really it's concentrated in an older population.
Yeah, and I think if we look at the population right now, even if we're saying, we understand that for the whole population, there's not a large prevalence of the infection, 2 to 4 to 5% maybe. But if you have that 2 or 4 or 5% in that large crowd, the virus can certainly spread exponentially with that.
Yeah, and I don't think the sun and the pool and the alcohol are going to prevent the alcohol or prevent the spread of the of the virus. So that's probably an interesting question, Dr. Girod, as we think about reopening there and reopening in the athletic areas. Jeff, what do we think the role of masks are going to be? Because as I sit there thinking, maybe masks are really important on the campus as well.
Well, I think, of course, by the time we get to August, we're going to know a lot more. I've heard you both say this repeatedly every week. We're going to know so much more in 2 weeks, and so I think we'll know a lot more in a month. But, if we had to do it today, I think our if you can't social distance, our expectation would be wearing a mask.
Yeah, the good news is, and I'm gonna say this out loud. and I'll probably be in trouble for it, but we talked before with Senator Moran when Francis Collins was on our at our board meeting about his belief that we would really have a vaccination available in October with widespread use by late December, early January, which is a faster timeline than most people are saying. But man, if we could be vaccinated, that could open up Allen Fieldhouse. That would be the best to get back to KU basketball.
Of course, that's what it's going to take, right?
It
It's
is.
either going to take widespread vaccination or widespread infection.
Yeah.
One of the two to
do
really
that.
get us to a place where we can safely have that shoulder-to-shoulder
Yeah.
experience that
especially
we're all
when you're
used to.
shouting and screaming and your
Yeah.
secretions are going everywhere, and it's like, okay, we'll call those super spreader events.
Yes.
Those are tough. Those are really tough. So I think the thing about self-quarantine, if people would be willing to do that, that's great. I don't have a lot of faith about that, to be bluntly honest, but I do think that means you ought to wear a mask, and that's a matter of personal and social and our societal responsibility right now. Other questions?
So Casey Jones here from KCTV 5 while we're talking about masks again. So it's pretty alarming when you go out and you see all these people not wearing a mask. So what can you do if I'm personally wearing a mask? How much am I protected? And what do you say to those folks that are not wearing masks to potentially get them to wear one?
Well, that's a great question. I don't know what the right comment is to tell to somebody else that they ought to wear a mask.
Yeah.
What do you think?
Well, I think
I'm going to punt right this to you, David.
to start, the face masks that we're talking about, for most people, are probably going to be the cloth face masks.
Yeah.
And we have always said that those do not offer you the individual protection from the infection. What that offers is protection to the general public from you should you happen to be asymptomatic or pre-symptomatic. It is able to filter or catch some of those larger droplets and at least reduce the amount of secretions and virus that may be expelled if you are coughing, talking loudly, sneezing, things of that nature.
Yeah, I think that's really the key. It doesn't protect you from breathing in stuff because cloth masks aren't effective for that. If you have more of the surgical mask or medical grade mask, then they'll offer some protection. But really, it's about your secretions going out. And as far as what to say to somebody, I don't know that I have a great answer to that. Please.
Maybe I'll ask you a question. I've been struck by going into businesses that some are really good about it and some
aren't.
have zero.
Yeah.
And quite honestly, that will dictate where I spend my money. But I don't know if you have advice for businesses. I'm just shocked that some aren't requiring their employees to wear masks.
Well, in fact, my wife was out buying some, kind of curbside stuff, and the first thing that happened is they didn't want her to order anymore. They told her that she needed to come in, and so they didn't want to do the phone order. And then when she got there, none of the employees had a mask on, and none of the patrons had a mask on, and they were all shoulder to shoulder again, just like they always were at this place. And it's like, wait a minute, that's really not a good idea. So we're not going back. I'm like you, forget that. I don't want to pick up that. And so I think, again, it's this sense of either invincibility or lack of believability. Either and unfortunately, to some degree, this whole pandemic has become a little politicized. Some think that it's not true or that it's overblown. And I'd be happy to introduce you. Well, I can't really for HIPAA, but if you just met some of the patients here or some of the folks from nursing homes or the meatpacking plant who have all been sick, I don't think you'd think that it was a fake. This is not fake news. This is real news. And how we respond to it and treat it says a lot about ourselves as people. We have to see past the politicization of it and really just do the right thing around health and around taking care of the people we care about in the world, I think. So I'm with you. I just don't go spend money in places like that because they're not being socially responsible. So why should I support that attitude? It's tough.
We have to get to a culture of acceptance of masks, which you see, for example, in Asia, which they've had for many years. Part of that's due to the air quality, but they're just, it's very natural for them. It is not here.
No.
I agree with you. I think there's a large cultural component to this. This is a different day and age right now. We understand that wearing masks can protect others from yourself. But again, I think it's also, there's a lot of politics involved. It's not about freedom of speech. We are not telling you, the government is not telling you need to wear one. There are people, there are groups who are out wearing masks all the time, whether they're riding horses or motorcycles, they wear bandanas. During demonstrations and protests, people wear masks. That doesn't seem to be a problem. I think we can do that. But wearing a mask for 10 minutes while going into a store, that's absolutely, you can't do that. I think you can do that in those cases because you're doing it in other cases, and we see it every day on the news. So, and again, it's probably not even long as riding a long motorcycle ride or demonstrating for 3 or 4 hours. You're just going in for a simple errand. Wear a mask, come out, wash your hands, do alcohol sanitizer, take your mask off.
And we don't have masks on here, but we also know that we are 7 feet apart, which is intentional. And we measured it from one person's mouth to the other person's mouth to make sure. And so we always say that just to affirm the message. But as soon as this program's done, we start to walk out, we're all masked again.
Right.
So it's a thing. So what do you say to somebody who's not wearing a mask? I don't really have a good answer. You got to decide what your own zone of comfort is around confronting others about mask wearing. And unfortunately, because it's become a little political, it gets categorized that way, and that's wrong. And the worst part is that, and we know it from the health statistics in our county, that people who don't have as much money or people who have to live more closely together are going to have a more difficult time with this. So it also becomes a little bit of an issue of economic privilege, and that's just the reality of how COVID hits people.
And there has been a population study as well. It's in a preprint. It's not peer reviewed at this point, but there was a population study about countries that mandated mask wearing as compared to countries that did not mandate mask wearing. And what they found was that the increase in deaths was about 40% per week in countries that did not have mask wearing mandatory. But in countries that did mandate it, their increase in death was only about 2% per week. So there is some good population studies out there, early preprint stuff that does show that mask wearing can help and improve, overall death rates.
Yeah, it really does. So other questions this morning from media?
What about when to wear a mask exactly? I think there's a little confusion about, like, if I'm out at a park, do I need to wear one? Or, like, at what point is it okay to take it off, and at what point do I need to keep it on?
Yeah.
Dana, it's all about how much you're around folks.
Yeah.
Again, I mentioned this weekend I was down in around Roaring River in southwestern Missouri, and then part of, not in the state park, but in the national forest part, and there was nobody else down there. I did not have a mask on. I don't think I could give it to trout. I'd like to catch plenty of trout to try and find that out, but I can't give it to trout. I'm not going to give it to the trees. But that's not true in a lot of other more closely packed areas.
And we've always endorsed being outside. We want people to be active and be healthy and be outside. If you're in your bubble with your household and you can otherwise maintain 6, 8, 10 feet away from everybody else, you probably don't need to wear a mask. But in those other circumstances where there are groups of people who aren't from your household and meeting and having picnics, you probably should be wearing a mask in those instances, even though you're outside. The risk is much less being outside, of course, because of the turbulent airflow and currents and stuff like that. But again, if you're not in the people from your household, in your bubble, and you can't maintain that distance, that is really when you need to be wearing a mask. Now, if you're inside, then you probably absolutely should be wearing a mask because it's going to be a little bit more difficult. It's going to be a confined space.
Yeah, and I think, again, back on the college campuses, Jeff, what about athletes? Or do you think my approach would be, gosh, for now, man, when you're working out or the athletes around each other, wear a mask, because we think of athletes as these strong, super healthy folks, but the reality is they can be vulnerable to COVID-19.
Our protocols for when they do return, we opened our offices to our coaches and staff Monday the 18th, and masks are required. We have the control checkpoints entering the facilities. We have the questionnaire. We take the temperature, and then we require masks on all of our employees. So, and we'll do the same with our student athletes when they return. We've had our partners in Adidas provide us some 2,000 masks for our student athletes. So we will issue those to our young people when they come back to campus, and definitely masks are part of our protocols. And, we feel really good about being able to follow protocols and such within our facilities. As you all have mentioned, it's when they are out in the community, like the Ozark site, that we get more concerned about our student athletes. So we'll be educating them, continuing to remind them about the personal responsibility they have to themselves and their teammates and their coaches. So, but short answer, masks are really very much part of what we're going to do when we return back to campus.
Yeah, I'm just thinking that if I'm the quarterback, I'm going to make sure every lineman wears his mask, because if they start getting sick, I'm in deep trouble. That just sounds like a bad idea, Dr. Gerard. So do you have some pretty cool looking Jayhawk mask?
What's that?
Do you have some pretty cool looking KU masks?
I do, thanks to Jeff Long.
Yeah. All right.
We have more on the way, Champ.
Yeah, as do we.
Excellent. Well, I'll be coming by sometimes if I get my good looking Jayhawk
We'll
mask.
style you up.
All right. All right. Other questions out there, media?
I have one more. I'm sorry. I have one more on blood thinners. Are you, when you're treating COVID patients in the hospital, do you send them home on blood thinners, or, how concerned about clotting are you in the treatment?
So that's been some more recent data, Dana, that's talked a little bit more about seeing these very small vessel blood clots throughout the body, in the lungs, the brain, the kidneys, the liver, heart, and causing really end organ damage that threatens lives. So we've been starting to use more things that will thin the blood. How long do we need to keep those going? What population of patients do we use them most in now?
Yeah, so in general, the blood thinners are for patients who have had blood clots or at risk. If we're talking specifically about our COVID-19 patients, our therapeutics group has done a great job of looking at all the data and analyzing everything. We do have specific algorithms for putting people on blood thinners when they come into the hospital, and then most of them are going to be sent home for some period of time, and that time period is kind of just dependent on a few other factors. But certainly we are aggressive in patients with COVID-19 and making sure that we can keep their blood thin and reduce the amount of blood clot burden or complications of that nature.
Yeah, it is a big deal, and we do know that the use of these blood thinners seems to save lives in patients. So,
yeah, because even when patients recover, don't even have to come to the hospital. We have seen this, here at KU, but there's also been other national stories. They recover at home, and then it's 2 or 3 weeks later. And again, this is probably from direct viral damage to the endothelial lining, but it's also part of the inflammatory process that occurs. And I think Dr. Gronseth talked about that in a great fashion last week about blood clots. So.
Yep. Other questions?
Hi, this is Amy with KCTV5, and I had a question about nursing homes. There's a new cluster in Johnson County, and I'm just wondering, once there is a case or two inside a nursing facility where everybody has, so many of them have compromised immune systems, it's just they're so much more vulnerable. How hard is it to keep it from spreading, and what do these facilities need to do immediately once there's been an identified case to protect the others?
Yeah, we've known there have been some cases. I know over at Bishop Spencer Places, for one, they believe they had one case. They were able to isolate and not have it spread. I think that's not always the case, Dana, but part of it is early recognition, and then really, 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 really vigilant infection control, isolating, and again, all those things we've been talking about, gown, glove, mask, and things of those natures, washing your hands, etc.
Yeah. I think the first thing they should do is, immediately contact the county health departments. The county health departments and the state health department is really attuned to this and definitely have the resources for it and have done the contact tracing and the testing. So that's what they should do first. And then obviously by now you would expect that there would be the infection prevention and control measures in place with face masking and goggles and contact droplet precaution going on. So I think the first thing to do is certainly get into contact with the county health department.
Yeah, and I think that is an important role. And then you can control clusters if you cohort well enough. That's been demonstrated in several other nursing home outbreaks. But you have to be, again, it's all about how super aggressive you are, how you treat the patients, what staff get to isolate, get to interact with those patients, and then how you go about that. And so I think that is going to tell us some story about dormitories and things like that, Dr. Joy. Because it feels like once we know, first of all, we're going to have really good testing on the Lawrence campus, and we're going to have to be able to isolate and quarantine kids or once they have the disease, or staff for that matter.
Absolutely, and so we are ramping up all the said. I mean, so we're ramping up our capability for testing. We know that we're going to have to do quite a bit of that, as we will with athletics as well. We know that that's going to be a big part of the protocol. The contact tracing, particularly in our dormitories, there's some, that does make it actually a little bit easier to do it in that environment than if you're out in the community. We're looking at perhaps some technology to help us do that. There's some apps that are starting to come out that we're working with a partner on that to see if that might help us do that. And then we are setting aside a portion of an entire facility for quarantining, self-quarantining, and quarantining while we go through the process. We know that we need to address all those.
Yeah, and as I think about that, in each one of those areas, the contact tracing is really important. But then the students maintaining, if we can get the students to do really good personal responsibility, then I think it'll make things a lot better for the rest of the students who are around them.
Absolutely, and the Greek community has already reached out to work with us on protocols as well. They're worried about all the same issues,
Yeah.
and so. And there's about another 4,000 students in the Greek community, so we'll be working closely with them as well to make sure we all have the same capabilities.
When you think about it, 20,000, 24,000, 25,000 students back into Lawrence, that's like its own town, its own community right there. That's a lot of people.
It is, and that's just the students, and then we've got another almost 10,000 faculty and staff, and so it is a community in and of itself, and anything that can happen in a community of 30,000 can happen on our campus. And so
Yeah.
we have to look at it that way. And we have vulnerable populations, just like any community does. And the average age of our faculty is on the older side, and we are at risk. I guess I'm now one of those.
I was going to say, you and I are part of that older. Be careful with that, brother.
So, we really have to look at it from all aspects. And as we think about operationalizing it, it's going to be fairly disruptive to our academic calendar, to how we schedule classes, to how we conduct or not conduct large classroom events. Really all that's going to be worked on over the summer to make sure we can minimize the risk.
Right, and I'm thinking you're going to still have to have Zoom classes as well as live classes, and because
Absolutely.
especially if students are being quarantined.
And we need to recognize that our students, first of all, some of them may not be able to get back to campus, right? If they're an international student, we have 40% of our students are international or out of state, and some of those just may not be able to come back. Some may not feel safe coming back given their underlying health condition. So we have to be able to make sure those students continue to progress. And then we just have to acknowledge that we plan to open face-to-face, but if something happens in the fall, like happened in the spring, we might have to shift again in some way, shape, or form. And one of our librarians found a nice article from 1918.
Oh boy,
When
that great pandemic.
They shut down
the flu.
the city, and they did not allow anybody to leave the city in 1918. They just quarantined in place for 2 weeks.
Yeah.
So we've been here before, and if we have to do it, we'll be ready to do it. But we certainly hope we don't need to.
Yeah, and the same techniques used in 1918 that worked then are the techniques that work now, and it helped to shut down the flu epidemic in 1918, just as we're trying to shut it down. And Jeff, as I think about athletes, one of the things I read about all the virtual workouts and the Zoom workouts and the Zoom team meetings, are KU coaches working with athletes in that same way?
Absolutely. We follow, obviously, NCAA and Big 12 guidelines on that, and those have started out slow, but then they've opened up, and so now our coaches are allowed to have 8 hours a week of virtual training, really strategy sessions and such. We've not permitted virtual strength and conditioning workouts simply because we require an athletic trainer, a medical sports medicine staff member to be present for that, and we can't ensure that with virtually. But our coaches have definitely utilized the virtual world for their coaching, but also probably more importantly, we've used it in our academic support, where we have provided 1,000 tutorials a week virtually to our student athletes. So we have quickly moved to this virtual environment, and it's been actually working quite well for us.
Yeah, that's important. So other questions out there for media? All right.
All right, we have tons, so if we don't get to all of these, please bear with us, and we'll try to get to them tomorrow.
We probably won't get to all of them, but we'll try.
Right. Following up on the campus talk, there's a what, when, and how. What is it going to take for you to land on the plan? When do you think you'll land on it? And how is the best way that you'll communicate with the public? That's
Those are big
several
questions.
questions mushed into one.
As all good questions, the answers remain somewhat fluid. The what is putting together the plan, which we're working on right now, both our operations team and engaging really the health system as well to help us make sure we've got the best plan in place possible. We plan to be able to communicate that at least in phases. I don't know that we'll have all the answers on day one, but we will phase them in as they come. And actually, they're going to change because we know the recommendations are going to change between now and then. So we will plan for recommendations as they exist today, but the reality is that's not what we're probably going to be working with when we get there. So we're certainly hoping to do that through the month of June, and by early July have a plan in place, recognizing it's going to shift again.
One of the crazy things is just just even here in the health system, every day about 4 or 5 o'clock there at the beginning of the CDC or somebody would put something out, KDHE, and be like, okay, well, there goes that plan we had in place, and we'd have to revise it. And you do have to be pretty nimble around it because data changes so quickly.
But we also know, ultimately we're responsible for our own organizations and our own communities, and so they may put a recommendation out. That doesn't mean we're necessarily going to follow it right away.
Right.
We may slow step some of that because we're just not quite sure that applies to our population. We're just going to be really thoughtful about that.
And then you're always, outside events are going to change everything. If there really does, we do have vaccination available, in the late fall, early winter. That's a game changer.
It's a game changer for
if remdesivir turns out to be the next best thing since sliced bread, or if there are other therapies that come out, those are game changers and will really alter how we look at it, as well as any new information about infection control. I think the information about masks is becoming more and more powerful. That really if you look at how it's spread, it really is a droplet spread. It's probably not an aerosol. And the difference is aerosols are a little small, they hang in the air, and you can breathe them deep into your lungs. Not sure that that's so much viable virus, but the droplets contain a much higher concentration of virus, and for that reason, we think that they're really the way people are spread it much more than the aerosol.
Which I know the data suggests you're really protecting others, not yourself, but it's really hard to believe you are protecting yourself some.
Right, but we just, because that's been our message from day one, we have to expect there's probably a little bit of protection there. There's a little bit, but it's still a cloth mask. It's filtering, but maybe it protects you a little bit. We have to continue with that. It's certainly not a N95 mask or a surgical face mask like we wear in a healthcare facility, meant to protect the wearer. So,
yeah, I think the key is that when you look at the particle size, cloth masks do a really good job of taking out the large droplets. The number of particles that you exhale with a cloth mask drops to about 90–95%. And so your ability to infect someone else it goes down dramatically. So cloth masks make a huge difference. They may protect you a little bit, but they're really about preventing those bigger droplets, which have a higher concentration of viable virus, out into the air where somebody else can breathe them or get them on their hands and then touch their face. That's the mechanism of this disease. And as we said before, if it was really aerosolized and there were clouds of these particles all around forever, man, we would have been in a lot bigger trouble than we are. That's measles, right? Our things. That's a much worse.
Or TB.
That's a
which
much
are
worse.
Airborne.
Yeah. That's a worse respirable disease. Yeah.
But just to your point, exactly like you said, they have looked at surgical mask versus a cloth mask, and even the cloth mask can reduce particles, 40 to 80% of what that surgical mask. So it does offer a little bit of protection, but we just have to maintain that certainly in the healthcare setting, we aren't using the cloth mask, we are using the surgical mask, and the cloth masks are, the main goal is to protect other people from yourself.
Yeah, we've seen the super spread events like choir practices in which people are singing together, and there's a lot of stuff going on in the room. That just makes you more nervous about having crowds at athletic events because it's going to feel a whole much more like a choir practice, Jeff Long. So thoughts about when we're going to be able to be back at either Memorial Stadium or Allen Fieldhouse. And we mentioned a little bit ago about vaccination making a difference, but hard to think about how to do it otherwise.
Yeah, no question. We don't know how we'll be coming back into David Booth Kansas Memorial Stadium or Allen Fieldhouse at this point. We're certainly following all the developments. We are modeling. We've modeled 15 to 16,000 in Memorial Stadium, and to be honest with you, I can't. We've modeled Allen Fieldhouse, but I can't bring myself to looking at it because I know how few people it will be, and that is upsetting. So I'm going to wait a while before I look at those numbers. But certainly the vaccines and the preventative things could help us. And right now, it's not a good look. But again, as you pointed out, in 2 weeks, 3 weeks, 3 months, we're going to know a lot more about what we'll be able to do and how our fans will want to come back. We certainly have a feel that our fans want to come back. We're well over 90% renewals for our football season tickets, so that's a good sign. And hopefully we will develop the ways to protect them prior to that first game on September 5th.
Dude, that'd be the best. So, other question.
Yes. What is Hashimoto's and what is the risk between it and COVID?
Yeah.
Tons of questions about
We
that.
get that question a lot about Hashimoto's. Okay, here's fun. Dr. Gerard is an ear, nose, and throat physician. So, as chancellor, I'm asking you right up front, and then we'll see what Dana thinks too.
We'll see what the
what Dana
expert says.
We'll see if he's going to validate that or not for you. So.
Well, Hashimoto's is an inflammatory disease that includes the thyroid. It's not exclusive to the thyroid, but it includes the thyroid, and it's thought to be autoimmune in nature. And it tends to be a fluctuating disease and can, over time, really burn out the function of the thyroid gland. But it can also release a bunch of, when it gets really hot, it can release a bunch of hormone as well and put you into thyroid storm. So it can go in either direction. It tends to go on for a long period of time. It can be somewhat difficult to manage over time. And it's clear, it's not clear what causes those flare-ups. And so maybe I pitch it to you to see, is it possible the virus causes a flare-up of somebody who has Hashimoto's?
Yeah, certainly I think so. And I think a lot of this question comes from I believe it was just a case report, not a case series, meaning multiple cases, but at least a case report of somebody who developed this thyroid manifestation or this Hashimoto's, I think 2 or 3 weeks after they had COVID. And at that point, they were linking it to the COVID-19 infection. So that would just go to your point about, this could be just one more cause of a flare of thyroid disease.
Something that you already had those underlying and then flared, but probably doesn't cause you to develop Hashimoto's by itself. We really haven't seen a lot of that in COVID-19 patients. So I think it would be less likely or harder to believe that COVID can cause the development of Hashimoto's, but certainly could lead, because it is an inflammatory state, lead to, as you guys both pointed out, you may have a worsening of your Hashimoto's, and that may even lead to your initial presentation. Doubtful that it actually caused it.
Yeah, so again, I think we are just learning more and more from our experience here in the United States. We are getting very good published cases, case series, overall data sets. We just kind of have to keep looking for that. And it's probably not surprising. We know that SARS-CoV-2 can just cause just atypical and weird manifestations in your body, either during or most likely after the acute infection. We just have to keep looking for those things. And as we get to better therapies and better ways to protect against these things of inflammation and inflammatory dysregulation, hopefully we can protect against these in general.
Yeah, that's a big topic.
How many people have died who did not have pre-existing symptoms?
Yeah, that's a great question because it's a little hard to know. So if you're purely healthy and you had no underlying disease, which means you're not diabetic, you're not overweight, you don't have high blood pressure, you don't have lung cancer or any form of cancer, you don't have chronic obstructive lung disease, you don't have underlying autoimmune disease, then the number of deaths here is very low, Dana.
Yeah, I mean, in the United States, it's hard to know. Here, we don't know. But without those other risk factors, your propensity or your risk of developing death or mortality is probably quite a bit lower. But unfortunately, and this is what people don't understand, we know this does happen to people who don't have underlying risk factors. And that's the real scary thing. And it doesn't matter about age or potential other risk factors. The propensity is less, the numbers are less, but we know it happens, and that's the unfortunate things. You hear stories about mothers and fathers all the time who are otherwise young and healthy, who were fine, and then 2 or 3 days later, had died. So we understand that happens, and that's the problem with this, is we just don't know all of the facts and details, and that it's a roll of the dice anytime you do get this infection.
Yeah, it can happen. It's just very unusual, and it's much more likely for death to occur to an older, more debilitated population, but that's not 100% true.
How about the syndrome they're starting to see in kids?
Yeah, it's the one that's a little like the Kawasaki's disease.
Yeah, absolutely. This the pediatric systemic inflammatory. Certainly, again, what has been said is that this is a small number of children overall. Obviously, if it's your children or someone you know, you don't want that to happen. But this is just another manifestation of this immune dysregulation, this inflammatory process that this virus can cause. Luckily, it is a small number, and for the most part, if your child has the disease, they are probably going to be okay and not develop it. But we understand that that's there, and so it's certainly important, should your child be ill after having known COVID, that's one thing that you would probably tell your medical team as you go in to look for treatment for them.
Yeah, and I think that's if it's indeed an inflammatory process, which it looks like, and it triggers an underlying process like Kawasaki's, there's still a very unusual, very small number of kids who get that. I know some of our partners at Children's have treated a couple of children with that, and so one of our goals, we'll get them on this program here in the near future and visit with them about Kawasaki's and some of the impact of kids and what children's folks are seeing with it.
Are daycare super spreader situations?
Oh yeah, that's another one. Okay, so one of the things, it's funny, my daughter lives in Chicago and works at the University of Chicago, and they were saying, when are we going to be able to return? And they're like, man, until we get daycare back up and going, it's tough to have folks back, and because no one, what do you do with kids? And so, have you guys confronted that question on the Lawrence campus for your faculty?
Our daycare is just starting to reopen slowly. And there are a few in the community that did not close, and that actually was really valuable for first responders who we needed to come to work. And I assume your system has had to deal with some of the same things. Your workforce needs that coverage. So, but their plan is a slow and cautious one. So we'll see how that goes.
Dana, your thoughts?
Yeah, I think it's dangerous. I think we do need childcare because people do need to go to work, and childcare is essential for that. But what we do know is that kids can't maintain physical and social distance. They are roughhousing, playing. What we know is that children can get either mild or no symptoms and still spread the disease. So when you have that combination, you can see how you can very easily spread it from one household to the other. And then obviously the parents in that household, or if there's grandma coming around as well, or living in the household, anything like that, it's so easy to spread. And those are the facts that we know. And then how do we best mitigate that risk? And that's a tough thing that needs to be evaluated every day.
Yeah, those things are hard, but they are part of our reality. That if we're going to reopen society, we're going to have daycares reopen as well.
Are shields better than masks, and is a level 1 mask a waste of money?
Okay, Dana, shields better than masks? Not really.
No, I think there are two separate things. So when we think of a face shield, I'm thinking of mostly eye protection, a big like welder's mask, but it's just usually a clear piece of plastic that comes down over your face, or goggles, so eye protection. So that's extremely important. That's an actual very good physical blocker of the droplets, but that is separate than a mask. Now, certainly I think I would endorse, if you wanted to go out, to a store or anything in public with a face shield as well as a mask on, I think that's perfectly good.
Mask, it certainly works. They are, I do believe they're additive, and they control things a little different way. But you can still get droplets in through your eyes, and that's why you would wear a face shield or goggles. So they are helpful in that regard. Glasses, because there's so much space around glasses, don't really do that. So our recommendation here in the hospital, when we see patients, is that we have to have either a face shield or goggles plus a mask on, and then other infection control precautions. So both are helpful. And I suspect, I know still in the operating room, you all have always worn something to help protect that.
Yeah, absolutely.
The same sort of reason, I think. So.
And the level 1, I don't even know what that
So
is.
level 1 mask, you want to address that?
Yeah, I believe all of our surgical masks are level 1.
They are. I think the question is,
masks.
are they worth money over? Is that so much better than a cloth mask?
Well, as we stated, that's what we wear. Our healthcare workers wear that. That may offer you more protection as the wearer. So it certainly be, if you can get a valid one that is truly from a reputable biomedical source and company, I think it's reasonable to do that.
As we wrap up today, I think we're getting near the hour, and I want to ask our guests if they have any last thoughts. Jeff, how about things from an athletic viewpoint?
Well, we're feeling positive. Again, we're monitoring everything, Dr. Seitz, as we go forward, but we feel positive. Our student athletes are eager to get back to preparing for their competitive seasons. Our coaches certainly are. But again, we're mindful of all the steps that have to be taken, all the protocols, and we're going to be following those diligently. But we're hopeful, and we're hoping this summer weather will help stomp out the virus. I don't know if there's data or facts behind that, but we're looking forward to the fall, and we appreciate our fans and supporters coming back when it's safe and when they deem it safe.
Well, Jeff, thank you for being on our program today. I know you'll do it right because that's the person you are. Speaking of always trying to do things right, Dr. Gerard.
Well, we also are excited for the fall. We do plan on being back in some shape or form on campus. And what our students tell us is when you ask them what they missed when they left campus, they do eventually get to us in the classroom, but there's multiple things before that, and it's really the environment and it's the personal development that takes place through all the co-curricular activities and undergraduate research and study abroad, et cetera. And we'll be able to slowly phase those things in, but we plan on doing that and doing it safely. But we're also going to be ready to flex as we need to flex based on the advice of our partners.
Yeah, and this is such a critical time. And, you know, as we look over the next few weeks, I suspect folks out there get a little frustrated or tired of hearing us say, gosh, we're going to know more. We're going to know more. But that's the reality that we've lived in because we've not been through COVID-19. We borrow through old experiences with pandemics or the plague in Europe and you know, in the 17 or 1800s. And we would like to think we're so much different and we're so much more advanced. But the truth is, when something new comes along, like SARS-CoV-2, for which there is no therapy initially, we're really not any more advanced. We know more about what to do, but what we know is we should do the same things we've always done to help control the spread of infection. And those things are the things we preach on this program every time we get together. Wear a mask. Wash your hands. Don't touch your face. Cough into your elbow. Maintain that 6 feet of distance or more. You know, the world's not going to end. We're going to be okay. The question is how many people are going to be okay and how many folks are going to get through this with less loss and less pain and suffering. That's really what we're trying to do. We're trying to minimize the impact of pain and suffering throughout this crisis. SARS-CoV-2 doesn't care if you're a Republican, a Democrat, an independent. It doesn't care if you're white or black or pink or orange or green. We all have to respond to this together because we are in it together. And together we'll find our way through it. We said on Friday, sometimes it just takes time. That's a story. Sometimes it just takes time. So in the meantime, remember, there's still no place like home. We'll be here tomorrow.